What is glaucoma?
Yeah, glaucoma is an eye disease that everyone's heard that name, but a lot of people don't know what it is. And basically what it is the pressure inside the eye is too high for the optic nerve to tolerate. And over the years, that pressure takes a toll. It can cause nerve damage, and as the optic nerve is damaged, you can actually lose vision. The tricky thing and the difficult thing with glaucoma is that early glaucoma is completely painless, and a lot of times you don't even know there's anything wrong. So you can start getting a progressive peripheral vision loss that you wouldn't even know it's there unless we test for it.
And is that why it's called the silent thief of sight?
That's exactly right. It's painless, in some ways similar to high blood pressure. A lot of times your blood pressure is high for years, and if you never go to the doctor, you'd never know there was a problem. So the same thing with glaucoma. You can have pretty severe glaucoma. If you've never had an eye exam or don't get your pressure checked, you wouldn't know you have it.
And so if somebody is walking around and all of a sudden the peripheral vision starts to change, then that's, I mean, they're supposed to have an eye exam every year, I understand. So, and so that would help take away some of those consequences for people with glaucoma.
Exactly. The beautiful thing about our glaucoma treatments today is that we can often prevent progression of visual loss due to glaucoma. And we showed the graphic on the screen. Basically, it starts out as a very peripheral vision loss, and it works its way toward the center. But it's a sad day in the clinic when I see someone that's never had an eye exam and they're coming in with loss of vision, and we see them and their nerve is severely damaged due to the glaucoma. Once you have the damage, it's hard or impossible to reverse it. So the goal is to lower pressure and keep it under control to prevent progression over time.
How do I know if I have glaucoma?
The only way to know if you have glaucoma is to have an eye exam, and it would involve an examination of the optic nerve combined with a pressure check. And pretty much any optometrist or ophthalmologist you see will look at the pressure, and often they're doing an examination of the optic nerve as well. But what I encourage all of my patients or anyone listening to do is just ask, you know, especially if you have a family history, mention that to the doctor and say, hey, I have a family history, I'm concerned about glaucoma, what do you think? And they can give you their honest opinion on whether or not they think you have it. If there's a concern that you do, often I get referrals for glaucoma evaluations from outside eye doctors to essentially get a second opinion or consider treatment like laser or even the eye stent or ECP. So that's really the first step, is to get your eyes checked, because as we said, it's painless, and a lot of times you wouldn't even know you had it just by using your eyes.
Is there a way to prevent glaucoma?
Prevention is something that at this point we don't really have anything available. The main prevention that I recommend is surveillance, which is, you know, getting your eyes checked, and if there's any sign of glaucoma, I want to know about it. And even if we're not starting treatment, I want to watch the nerve over time just to see if there's any sign of a rising pressure or any progressive thinning of the nerve, and that can be an indication that we have to start treatment to prevent vision loss. So prevention is key, and the surveillance with eye exams.
Are there different types of glaucoma that we should know about?
There are. The most common type of glaucoma is open-angle glaucoma, and that's the type that Dennis had, and that's the kind that we're treating most often. It's associated with age, as when we're like a lot of things, unfortunately.
Yes, I hear that a lot. Everything that we talk about is because you're getting older, Wendy.
Yeah, no, I know. But actually not always. The kids can get glaucoma.
Oh, really?
And even, you know, some celebrities like, you know, Ray Charles, he had congenital glaucoma, and so you can even get it as a newborn. So, but.
And that's why Ray Charles was blind, was from glaucoma?
I believe so, yep.
Wow, I didn't know that.
Can a cataract that transgresses into glaucoma because I can't talk because I'm so excited to be on TV. Can it become from an injury?
Yep, that's a great question. There is traumatic glaucoma and there are traumatic cataracts. And that's something that in bad injuries we can see. And sometimes they can be very concerning and require surgery. Traumatic cataracts in particular are quite common after significant injury. They can develop pretty quickly. The same with glaucoma. That's one of the main reasons for close follow-up after an injury. And anybody that's had any type of injury that's concerned, if you've had any vision loss or any pain or anything, we like to take a look because the eye is very delicate and we want to make sure that everything is behaving like it should.